Dr. Leininger. My name is Michelle, and I'm from Northwood Valley Medical Center.
Hi, Michelle. Just call me Madeline.
Okay, perfect, Madeline. I'm the clinical nurse educator, and our hospital is going magnet status. So I was wondering if I could ask you a few questions today to try and implement your theory into our hospital setting.
Absolutely.
First question is, how greatly is the cultural makeup of the United States changing?
Well, the United States have always had changes in its cultural mixes, take into account except the Native Americans who have been in the United States since it began. But in the last 2 decades, with all the immigration and people coming from different cultures and countries, it's really hard for the nurses to know exactly what to do. So it makes it difficult for them to do their jobs.
Okay. What impact does this have on nursing?
Well, in most urban hospitals, you know, in a period of a day, you could take care of up to 20 different cultures, and without knowing what to do or what their cultures are, it's really difficult for the nurse to meet every one of their needs.
Would you be able to give some examples?
Sure. Well, let's take someone from Saudi Arabia. If I was to approach you as a patient and you're from Saudi Arabia and I handed you your pills that you needed to take with my left hand, you wouldn't be able to accept them. You know, the left hand is considered dirty in Saudi Arabia. So for me to hand it to you and you not take it, I would think, well, you know, what's wrong? But if you were to take it, it would be, you know, considered a dirty medication. So without knowing that, are you okay? Without knowing that, you know, without a nurse having those kind of, and even in Mexico, in the Mexican culture, if I was to look at your baby too long or admire it too long, it would be considered giving the baby the evil eye, the devil's eye. What?
This is vital information for all nurses, I think, to know.
Yes, it is.
What can the nurses do to get the patient's cooperation in a situation like this?
Well, I think first off that the nurses must work with the patient's values and beliefs. They need to find out from their patients what cultures medically or physically are accepted in their culture. So if I was to come up to you and say, touch your knee, in some cultures you're not allowed to touch a person. Or if you needed a special ritual before you took a pill, or, you know, it would be nice to know that. So me coming to you and asking you as a patient what works for you in your culture and in your beliefs, I think as a nurse that makes it easier for both me and the patient.
Definitely, definitely. Let's see, next question. Is there a danger, sorry, I'm very nervous.
It's okay, honey, you're doing great.
Is there a danger of thinking of all people from one culture as alike?
Of course there is, because as we know, everybody from every culture are not the same. An example is, you know, in the Hispanic cultures, there's Puerto Rico, there's Cuban, there's Mexican Americans, they're all different. And so in us thinking all of them are the same, I think it just leads us down the road to disaster when it comes to nursing care and patient care.
Okay. How can a nurse be sensitive to beliefs she knows nothing about?
Well, the nurse has to be educated and understand the different cultures and religions and what they believe and what they don't believe. And I think, once again, just coming to a patient and their family and asking them, you know, what's acceptable, what's not acceptable. I think the more education you have about it and implementing it into your hospital is what's going to make a difference.
Does transcultural nursing make nursing harder?
No, it actually makes it easier. The more we know about different cultures, the better we are able to serve our patients, and that's our main goal as nurses, is to take care of not only their physical needs, but their spiritual needs and their emotional needs. And sometimes their families are involved in that, and that's a big, huge aspect of making a patient comfortable. We can walk in to a room and you can be an Asian woman and your father's in the room and I'm talking to you, but he makes all the medical decisions. So me talking to you does nothing for the situation. It would have to be me talking to him to get, to get his permission, as an example.
Okay. You you what, I would love to ask you more questions. Maybe we can invite you to our hospital.
Absolutely.
And you could help talk with the staff, and we can get your theories on board.
I would love to.
Thank you very much for being
And
here.
congratulations on your new boy.
Thank you very much.